Dr. Shannon M. Clark here. I am a double board certified ObGyn and maternal-fetal medicine specialist, and I had my twins via IVF. The first thing I want to say is that OBs cannot not let you do anything. That's the first thing. Now, in 2021, the Society of Maternal-Fetal Medicine put out a consult series number 60 called Management of Pregnancies Resulting from IVF. And this recommendation regarding delivery is in those patients who are otherwise uncomplicated. The only risk factor they have is conception via IVF, the only one. And they say this: in the absence of studies focused specifically on timing of delivery for pregnancies achieved with IVF, we recommend shared decision-making between patients and healthcare providers when considering induction of labor at 39 weeks of gestation. Shared decision-making. So that means for IVF pregnancies with no other complications, none, it's shared decision-making. A conversation needs to be had between the patient who conceived via IVF and their obstetrical care provider. Also know that when there's a recommendation about anything that'll say blah, blah, blah at 39 weeks, that doesn't mean 39 weeks and 0 days. 39 weeks means anywhere between 39 weeks and 0 days and 39 weeks and 6 days. So a recommendation about a certain number of weeks includes that 5 days or 6 days, sorry. Let me just touch on a few of the other recommendations made in this consult series from SMFM. They say, given the increased risk for stillbirth, we suggest weekly antenatal fetal surveillance beginning at 36 weeks, 0 days of gestation for pregnancies achieved via IVF. Notice in that recommendation, they said 36 weeks, 0 days. We suggest that an assessment of fetal growth be performed in the 3rd trimester for pregnancies achieved with IVF. However, serial growth ultrasounds are not recommended just because of IVF. So those are the 3 main recommendations put out by SMFM regarding that last trimester of pregnancy for those who conceived via IVF. Now, ACOG put out a obstetric care consensus in 2022 about pregnancy at age 35 years and older. And since a lot of patients who conceive via IVF are 35 years and older, let's talk about what they say regarding timing of delivery, because age 35 years and older is also a risk factor. They say this: we recommend proceeding with delivery in well-dated pregnancies at 39 weeks 0 days to 39 weeks 6 days for individuals with anticipated delivery at age 40 years or older due to the increasing rates of neonatal morbidity and stillbirth beyond this gestational age. So if you're 40 years and older and you are delivering, that recommendation is for you. So if you conceive via IVF and you are less than 40 years old, that shared decision-making conversation should be had regarding timing of delivery after 39 weeks. If you are over age 40 and conceive via IVF, the recommendation is going to be delivery at 39 weeks 0 days to 39 weeks 6 days. I hope this helps.